I'm sure you see these patients on the street or everywhere because it's very common in the Philippines. It's about 1 in every 500 births. So for every 500 babies, we have 1 or 2 babies with that cleft lip and palate. That's an issue there. That's why it has to be treated because one, as they grow older, if it remains unrepaired, the cleft lip is the focus of the other kids. They get teased, they get bullied. You know, some of them don't want to go to school anymore because of the deformity.
Ako po si Alea Bukbederoso, isang ahente at voluntaryo sa Noordhoff Craniofacial Foundation. Nagpo-volunteer po ako para sa NCF kasi nakatulong siya sa akin ng sobrang laki. Pinaka-atlantic ko na rin po sa kanila. Sa ibang pasyente, parang
the cleft lip, there's a deformity in the way they look. And then for the cleft palate, this is the more crucial one. It affects eating, speaking, and general oral hygiene. Of course, when you're a baby, your palate is open, it's very hard to suck on milk. Just the effort of feeding, it tires them out. And most important is the speech. Okay? I'm sure you met people who are what we term ngongo. It's what we call hypernasal speech. It happens because if you have a cleft in your palate, you can't close off your space between your mouth and your nose. So if you're unable to do that, one, you can't be understood, you can't get a job, you get teased, you know, so that's a big problem.
Most of them come from poor families. Their education is a little bit compromised, but I see them struggling, trying to finish college, but then the next step is to find a job. So the future for Noordhoff Craniofacial Foundation Philippines is not just to help the patients with their facial disability, but to help them go beyond that and then to become better members of society.
So we're here for cleft and craniofacial treatment, but not just that. We would like to give these children with craniofacial deformities, if I could say that, you know, a chance to be like anyone else, normal. We envision that these children, these patients, bring back to society, and even because of their productivity and contribution, be even outstanding members of society. The organization actually began in the scholarship of the one who brought it in the Philippines. That's Dr. Glenda H. De Villa. She studied craniofacial surgery in Changgong Memorial Hospital in Taiwan, and there met the members of the foundation of the Noordhoff Craniofacial Foundation, and Dr. Sam Noordhoff. She was inspired by what they do in Taiwan and then decided to bring it here. She came here in 2002 and started doing surgery in Our Lady of Peace Hospital.
I chose to start a center where we could treat patients with cleft lip and palate comprehensively because I had been to several cleft missions already, and all we did was do the surgery of the lip or the palate, and then we never saw the patients again. But in my training, I saw the full range of treatment of a cleft patient, and that is what I wanted to do. Plus, it is also what we need here. We don't need to just do the surgery and then forget about the patient, because the patient is a person who grows. And so with the cleft problem, there different cases arise also. After you fix the lip, you have to fix the palate, and then you have to check the speech, and then you have to look at the teeth, and then you have to look at the face. So that is why I wanted a center and not just a mission.
I'm an orthodontist. This is my role is I treat crooked teeth, right? So my role is to, number one is to straighten these teeth, prepare these teeth for eventual surgery, improve the appearance of the patient, and as the patient's appearance improves, then their confidence also improves. I treat patients as young as newborn and until adulthood. Well, orthodontic treatment is expensive with regards to the materials used and the time spent, because on the average, I treat patients for 2 years.
So in Our Lady Peace and at the Philippine General Hospital, the foundation sponsors them for those indigent patients. We spent around $500 to $600 US per case. So that comes to around 20,000.
Well, if I compare them with my other non-cleft patients, they're more difficult. Their cases are more difficult to treat, more challenging, but it's very fulfilling. You'd be surprised, they're very cooperative. They know, they value what we do. So they know how costly it is. I mean, without the foundation, they won't be able to have that treatment. So they're very appreciative. They come here as advised, and then their reaction once their treatment is done it's very fulfilling. It's very heartwarming, actually.
Aside from the operation and the process, we look at the person in her entirety, a holistic look of it. So it's not just healing the face. We heal, I would say, the soul. We heal the hearts of these people. That's why the motto of NCF is Love Makes Whole. The foundation is here to give love by doing quality work. We want to give love by giving the service as best as we could.
Noordhoff, maraming thank you. Kundi dahil sa inyo, hindi mo salita ng maayos. Mas na-improve yung salita ko. Sa mga doktor, sobra. Tapos, na-invite na rin po ako ng foundation namin. Thank you, sobra.
I would want to tell this, especially to the young people, if you want to make a difference to a life of a child, it's good to join any foundation of your cause or any advocacy. For NCF Philippines or for the Noordhoff Craniofacial Foundation Philippines, please come over, discuss your ideas with us. We're open for a lot of creativity, but the foundation needs workers in the outpatient department. Comprehensive cleft care is available. That there's a multidisciplinary team that's here to receive them. Let us know how we can also help you volunteer.